Today we had one patient with septic shock. We started her on noradrenaline, norepinephrine. So one of paramedics student asked me how norepinephrine helps in septic shock. So in septic shock, the blood vessels are dilated due to toxins. The blood vessels, vein, arteries are dilated, right? And heart is pumping with a constant power, right? So heart is pumping with constant power and it is pushing the blood into the arterial system. So the blood is flowing in the arterial system which is dilated. And with norepinephrine, what you do is that we constrict the vessels. So when vessels, entire vessels are constricted from this much diameter to this much diameter, what happens that the speed of blood flow increases. And when speed of blood flow increases, it reaches to end organs. It reaches to liver, it reaches to kidney, it reaches to spleen, it reaches to brain, it reaches to skin, right? So when pressure of the blood increases, it reaches to the distal tissues, it reaches to the fingertips. But when it is dilated, there is not enough pressure for the blood to travel to the distal tissue to perfuse the end organs. So we deliberately narrow the blood vessel lumen with vasoconstrictor. And another thing is that this norepinephrine also slightly stimulates cardiac myocytes to contract stronger. It increases the inotropy of the heart, that is the force with which the myocardium contracts. But it is not that prominent as epinephrine, but it has slight myocardial contractility as well. But the main point is that it narrows the arterial system, right? If you want to experiment it, you can fit a wide bore pipe in the motor that pumps water, right? And you can fit a small bore pipe. So if you fit a small bore pipe, water will travel to faster distance with the same motor capacity. If you fit narrower pipe, water will travel to farther distance in that narrow pipe. But if you fit wide bore pipe with same motor strength, water cannot travel to that much distance as water will travel in the narrow pipe. So we deliberately narrow the lumen of the arterial system in septic shock.